These four Medicare mistakes could cost you hundreds, even thousands of dollars and keep you from getting the best coverage you need to address your Medicare needs. What's up, friends? Rob here with Agape Insurance, and I am a seasoned Medicare advisor. So let's dive right into mistake number one, and that is missing your open enrollment period or special enrollment periods. What we see often is many people have no idea really when to sign up for Medicare. And once their Medicare is activated, how long do they have to activate or to get on a specific plan or plans? And the one thing you want to be careful of is, especially if you're going to stay on original Medicare and go with a Medigap or Medicare supplement plan, if you miss that open enrollment period, now you will be subject to underwriting, which means you could be declined that plan altogether or paid 2 to 3 times higher the premium because you missed that open enrollment period. Once again, this is specifically if you stay on original Medicare and with a supplement, you definitely do not want to miss that open enrollment period because you missed that get out of jail free card, if you will, with your health. The other thing is you could incur lifelong penalties with your Part B, B as in boy premium, that's your Medicare Part B, as well as your Medicare Part D, which is for your prescription drugs. The second mistake is simply going on the wrong plan. There's two main options when it comes to Medicare. You can see the image here on the screen. Option number one is I stay on original Medicare. I get a Medigap, also known as a Medicare supplement plan. I get a Part D prescription plan and any other ancillary plan that I may need. Example, Medicare does not cover your routine dental, vision, and hearing. So if you had needs for that, you would have to get an additional plan. So original Medicare is going to give me the most freedom to go wherever I want to go. So I don't have to worry about networks. And I'm not going to have to worry about as many prior authorizations when it comes to getting certain medical procedures done. Bottom line is you have more control and more access if you were to stay on original Medicare with a Medigap, also known as a Medicare supplement plan. Option number two is a Medicare Advantage plan, also known as a Part C plan. Where on original Medicare, pretty much everyone takes. Now, if you're on a Medicare Advantage plan, these are network-based plans or managed care plans, which means the carrier, whether that be Aetna, Humana, Blue Cross, Cigna, just to name a few, and they're going to be different depending on where you live in the United States, but whatever carrier you get put on or you decide to go with, they are going to be in charge of your health care. Now, the good news is, in most cases, they are zero premium plans, and they give you all the extra ancillary benefits, such as dental, vision, hearing, over-the-counter card to use for like supplements and other things, as well as a gym membership and more. So for some people, that could be the best option, especially if they need the most budget-friendly option for their needs. But I see many people make this mistake where they choose the wrong plan, maybe because they tried to do it on their own or they were just, not advised correctly. And speaking of that, real quickly, is if you do not have anyone to help you, then call the number on the screen or visit the website and reach out to us. It doesn't cost you any more to use a seasoned advisor like us here at Agape than if you were to do it yourself. But the good news is now you have advisors working on your behalf that have many years of experience to help you get it right the first time. So mistake number two is simply selecting the wrong plan. Now, real quickly, before we go on to mistake 3 and 4, if you are getting value out of this video so far, please take a moment to hit the like button and the subscribe button. This just helps us get information like this out to more Medicare beneficiaries like yourself. Let's go on to mistake number three. Mistake number three is selecting the wrong drug plan. Whether you're new to Medicare or you're reviewing these drug plans every single year, which you should be doing because that's during open enrollment. You see the image on the screen here. That's from October the 15th through December the 7th. You don't want to make this Medicare mistake because it could cost you big time. And once again, this is why it's important that you deal with a seasoned advisor to help you get this right. But selecting the wrong drug plan, what do I mean by that? Well, you want to make sure that all of your drugs are in that particular plan's formulary, but also you may have certain companies or carriers that have that drug tiered a certain way, and the drug tiers are tiers 1 through 6. So you may have that drug with with company A tiered as a tier 3, which triggers your deductible, which this year the average deductible is $545 for 2024, where you may have company B where it is tiered as a tier 2 and it doesn't trigger the deductible. So these are things that you want to be aware of and the nuances that you want to be aware of when it comes to reviewing your drug plans, whether that's yearly or if you're going on Medicare for the first time. Now, the final mistake is simply this. I've said it throughout the video. It's not working with a broker advisor like us here at Agape. And the reason I bring that up is we are not captive agents, which means we do not work with just one particular company, but we work with multiple companies and in some areas with all the companies that may be available. Why is that important to you, the Medicare beneficiary? Because you're going to get the most unbiased approach when it comes to your Medicare needs. Because I like to tell people this, our loyalty is not to a particular carrier. Our loyalty is to you, the Medicare beneficiary, and we want to help you get these selections right the first time. So you want to work with a broker advisor. Let me be very clear. It's not that a captive agent is bad. It's that they only work with one carrier and they're going to try to put everybody into the same plan. Let me give you an example. I had someone that was going on original Medicare reach out to me through one of our videos like this, and they were going to get a Medicare supplement with company A that was going to cost them $30 more than company B. And it does the exact same thing. But because that person that called them over the phone only worked with company A, then that's the only plan they could offer. We have tools that we use that help us shop all the carriers in some areas, which means you can be assured that it's going to be an unbiased approach and that you're going to get on the best situation for your budget to address your healthcare needs. If you do not have one to help you there in your local area, call the number on the screen. Once again, it doesn't cost you any more to bring us into the situation. It just helps you a whole bunch to make sure that you get it right and make sure you understand all the fine print and all the nuances. So call the number on the screen, reach out to us to our website. Myself or one of our advisors would be more than happy to walk alongside with you during this journey. God bless you guys, and go watch my full Medicare 101 series here.